joke to Johnny and just enjoy the night, and please free to interact with us whatever way you'd like. So enjoy it.
Part of what I'm going to talk to you about is kind of the journey that I've had and how it came about and where it all started. And it started in outback Australia, and then how I got to be standing here in front of you tonight, and then also what we think we might be able to build going forward. Okay, this is not about technology at all. It's just really about a different way of thinking and using technology where it's appropriate, but really about a different way of thinking. I just don't think there's been a more compelling time, and I don't think we've ever been empowered with the technology to allow us to bring about a real positive disruption for the people that really need it, and that's our patients. And I thought that maybe I could use the technology that I'd seen at the place called the Hammersmith, where they'd invested some 28 million pounds sterling on going completely paperless and filmless in this radiology department the day I arrived. And it was up and down a dozen times a day, but when it was up, I thought, gosh, you know, if this worked, and if it's a little bit like the colour television, if it becomes smaller and faster and better and cheaper, maybe, just maybe, it could have implications back in the part of the world where I grew up. And so I basically decided to build a little teleradiology network, and we did that. I put ads up into all of the capital city papers over in Palo Alto and up into Asia for expressions of interest into data transfer. And then we didn't actually start with an X-ray, but bit by bit, we built this virtual network which linked these small communities around the clock around the world. I never ever invented anything with global diagnostics. I never ever invented anything. All I did was just bring technology off the shelf together and put it together in a way that it kind of fitted and was able to deliver a service. How can we take that to the next step? Well, in part, it's been very much around primary care, which is still a doctor-focused model. But listen, where's the patient in this new model? Well, she's driving to the clinic and trying to find a car park. She's waiting in line. She's in an overcrowded waiting room. We're talking in a language that doesn't even make sense in terms of supraspinatus and infraspinatus and subscapularis, all of these Latin words. It's not a patient-focused centre, and we ask ourselves, is this the best way of delivering healthcare? And look, we know it's not. What we want to do is try and stop patients coming into hospital by keeping them well within the community, and within the community, within the home. And within the home, we really want to empower who we see as the true custodian and curator of healthcare, and that's the female. We call her the Jinga, the real champion. And she's the one who's going to lead this tsunami wave of consumer disruption for the better. Every single patient I operate on, they must come with a carer. And in 92% of cases, the gender of that carer is the female. And it's the female who's the real gatekeeper, the shepherd, the protector. We call her the Jinga. And it's the Jinga who's actually the true custodian of healthcare. We want to basically build this around the gatekeeper of the family. And what we have two simple little tools. The first is, we see as critical, is actually empowering the Jinga with her own electronic health record. So a HER, it's mobilised, it's personalised, it's cloud-based, and every member of the family has a branch on the tree. And through various sensors, we're able now to acquire any of the biometrics at any point in time. We'll have a full chronological history of all the key milestones, immunisation journey for any member of that family, all in the comfort of the home. And that truly is step one of empowering the Jinga. So at 2 o'clock in the morning, when the little ones are crying, the other 3 are in bed, and now with the wearable sensors, we can actually send those biometrics through, and we can have what we call e-visits or e-consultations. And we have a little video tool to allow the patients to actually connect through without her ever having to get them up and into the car. And so what we've ended up doing is we've simplified the ecosystem by engaging, embracing, and enabling the Jinga in the sanctity of her home, so that she can care for everybody within that network. And again, these sort of enabling technologies are the things that are going to allow us to do this. Just using sensors where they're appropriate, without being uncouth about this, I get sensors put in front of me most days. I'm kind of sensor shagged. If I see another sensor, I'm going to die. But there is so many stuff out there that we can do, but some really clever stuff where we're using nanotubules to be able to get pulse rate and blood pressure. We're able to do blood sugar level. We're able to do respiratory rate. We're also able to do blood oxygenation. And we think we're very close to doing GFR, glomerular filtration rate for renal function, which is probably the very early indicator of toxicity with the metabolic acidosis and various other things that occur. The IT networks They're there, they're all in place, and just sensible workflow mapping and informatics. The problem is all of that is out there at the moment, but no one's really aggregated that into a really sensible, sound and a logical solution to bring about behavioural change. Okay, so what we're about is we want to look, listen, design, disrupt and transform a new world ecosystem, and that's it.